Before we begin, we want to let our listeners know that today's conversation will be discussing mental health crises. If you or someone you know is in need of help, please reach out to the National Suicide and Crisis Lifeline by dialing 988. Remember, you are not alone, and help is available.
Welcome to the Sacramento County podcast series, County Conversations. I'm your host, Kim Nava. Today, I'm here with Dr. Ryan Quist, Director of the county's Behavioral Health Division. Dr. Quist, thanks so much for coming in to speak about your division today, and we're very happy to have you on the show.
Thanks so much for having me.
You bet. So we'll go ahead and dive right in. So first of all, so our listeners can get to know you a little bit, can you tell us a bit about yourself, your background, and how you became in charge of managing behavioral health for the county?
Sure, happy to share. So I've been here in Sacramento County for over 5 years now, and it's been such a great opportunity to get to know the communities and just really enjoy it. Prior to this, so let's start at the beginning. I actually grew up in a little city called Gridley, which is about 60 miles north of Sacramento. I went to high school there and then went off to college in Southern California, lived with my grandparents, went to University California, Riverside. Ultimately ended up getting stuck down there, worked with Riverside County Behavioral Health for 16 years. And when the opportunity came to come back up north near my family, I grabbed the opportunity.
And here you are.
And here I am.
Well, we're very happy you came back this direction. So getting a little bit kind of into the weeds, we hear the term behavioral health and mental health quite often, but perhaps those terms aren't as interchangeable as we think they are. What would you say the difference is between the two?
Sure. Behavioral health, the term behavioral health is a larger umbrella that contains both mental health and substance use disorder treatment. So behavioral health refers to the full spectrum of behavioral health treatment and interventions.
Gotcha. Okay. So, Dr. Quist, we're getting closer to the holidays, right? We're got Thanksgiving, we've got other holidays coming up, and these times can be really joyous time for many people, but this also can be kind of a tough time for individuals. From a behavioral health lens, can you share what kinds of issues your department staff might see during this time of year?
Absolutely. The holidays can be a really fun time of the year. Many of the representations we see in media and that we associate with the holidays are those of individuals laughing, smiling, and joyful images. And we certainly want everyone to take the opportunity to embrace the positive benefits that come from spending time and celebrating with friends and family. But on the other side of that is a completely normal response and experience of stress around the holidays. We put a lot of expectations on the holidays. We sort of build them up that they're supposed to be this really amazing experience, and they can be, but we shouldn't build up those expectations too much to the point where it becomes unattainable. So, there's a lot of opportunities for there to be demands on your time, and there should not be an expectation that you have to always be joyful or always be happy. You're going to experience some stress as a part of that as well. So in addition to that, there's also a survey that was conducted by National Alliance on Mental Illness, or NAMI, that found that 64% of individuals living with a mental illness reported that their conditions worsened around the holidays. That could be due to separation from loved ones, personal grief, the pressure of gift giving, economic hardship, challenging interactions with family members, or even just the change in our shorter days where there's less sunlight that all comes with this time of year can bring about behavioral health challenges. So I certainly can share some tips around how to manage the holidays.
Please do. And it struck me what you said, that stress is normal, right? Like this is something that it's not unusual. And so I think that it's good that you're normalizing that. But yes, Dr. Quist, please share some tips that, those of us who need them this time of year can certainly benefit from them.
And a lot of this is going back to just the basics. First of all, we have to pay attention to our feelings. We simply have to pay attention to our feelings and recognize when we're feeling happy, when we're feeling stressed, when we're feeling like we need to get away from other people and have some alone time. So we just need to listen to our feelings and help our young ones that we may be caring for also feel comfortable doing the same thing. For all groups, young or old, it's best to try to keep regular household routines the same. So around this time of year, we start trying to squeeze in a whole bunch of different events. Some of the most important things are sleep is number one. I think everybody underestimates how important it is to have a regular sleep routine. You get off your sleep routine and it can impact your entire mental health and your entire ability to function effectively. But also just routine meal times, making sure that you're hitting those meals. We all can experience a time when maybe we become hangry. We want to manage our routine so that we don't get to that point. And third, we'd say make sure you have a plan. Create a plan in advance when you do feel stressed, what helps you not feel stressed. It could be anything, going for a walk around the block. It could be sitting down and reading a book. It could be making a meal with friends or family. But make sure that you have a plan that when you start feeling stressed, how are you going to deal with that? And then we want to also connect with community. So this is really a great opportunity and time you don't have to always give gifts that cost money. This can be a time to give time of your own and reach out and support people. That can be extremely effective, and it helps both the person you're reaching out to as well as it helps yourself.
Okay, and so Dr. Quist, what are some additional issues and or resources that you can provide?
Well, another issue that I'd sort of highlight is that there are seasonal mood changes that people experience, and this impacts some people more than others. So it's important for you to not be surprised if it happens to you, that there's actually something called seasonal affective disorder, which is a condition in which people experience symptoms of depression that are triggered by the change in seasons as the days get shorter. And while this form of depression often improves in the spring and summer, it's important to talk with your healthcare provider if you feel you're experiencing these symptoms. And treatment is extremely effective and can often be really easy to attain. But it's just important to pay attention. If that's happening to you, please reach out for help. One other pointer for the holiday season is avoid alcohol and drugs, especially for people in recovery. The holiday season presents challenges that can trigger the use of alcohol and drugs. Having a plan for navigating social events and feelings of loneliness can help you reduce the risk of falling back on using substance use in order to deal with those types of feelings. And for family and friends, it's also important to check in on those who may be struggling with substance use over the holidays. But regardless of whether you're in recovery or not, it's still important to make sure that we temper how much of alcohol we use during these times. It can be a time to be tempting to be a little excessive, and so we just want to make sure that we don't take that too far so we can keep our health.
Well, those are very practical tips and something I think that any of us could do. And I think, as you said, we know ourselves best. We know what helps us in these times, and planning ahead can really make the difference. So kind of piggybacking on that, what services does your department provide for residents in need of behavioral health support? Maybe something beyond what you said, if the exercise isn't working, meals, habits, routines. What does your department provide, and who does your department provide these services to?
Sure. As the county behavioral health agency, what our responsibility is for mental health services and substance use disorder services for individuals who have Medi-Cal. So more specifically on the mental health side of the house, we're responsible for those with the most severe mental health challenges. So we call this specialty mental health services, and this is when it's really having an impact on their life and functioning, ability to be successful, functioning in day-to-day activities. For those with mild to moderate mental health challenges, that would be managed care plans that would have that responsibility, but we're certainly happy to help navigate that and get you to the right place. On the substance use side of the house, it's a little bit easier for Medi-Cal beneficiaries. We're responsible for the full continuum. Anything related to substance use is the county's area of responsibility.
Got it. Okay. Something that comes up a lot people often make the connection between homelessness and behavioral health, that perhaps behavioral health issues might be a reason why a person would experience homelessness. So from a behavioral health perspective, Dr. Quist, what do you see as the connection? Do you see that connection there? What are your thoughts on that?
Well, there is definitely a connection. So that is true. What I'd say, though, is that we have such an extreme shortage of affordable housing within our communities. If I was to lose my house today, I guarantee that I would have behavioral health challenges. I would experience a lot of stress and an anxiety around the new circumstances that I was in. And it would be very difficult for me to get my footing again regarding, how do I get myself back to that good place? It's like basic needs. If you can't meet your basic needs like food, clothing, shelter, it's going to be hard for you to be able to maintain a positive mental state in your higher levels of functioning. One of the ways I sort of talk about this as well is, I definitely acknowledge that there is a behavioral health need for those who are unhoused. The fact of the matter is, though, that we have a housing crisis. If I had, in our last point in time count, there were 6,600 individuals that were counted as being homeless. If I had 6,600 affordable housing units that were sitting vacant with nobody taking advantage of them, then that would be a behavioral health challenge. Right now, we don't have enough housing for those that are on the streets. We need enough housing first. We have service providers working in our actual programs that are having a hard time finding housing for themselves, and they have a job. So, it's a really difficult situation for anybody that's looking for housing right now.
Yeah, agreed. So there are some new initiatives or services launching over these next few months, and what I'm thinking of specifically are Care Court and Prop 1. Can you share a little bit with us how that will impact both residents and behavioral health services?
Absolutely. So Care Court, let's start with Care Court. First of all, this is a new initiative where what we refer to as a collaborative court initiative, where county behavioral health is working very closely with the courts. And just to give you the basics, first of all, who's eligible to participate? This is for individuals who are 18 years of age or older, diagnosed with schizophrenia spectrum or other psychotic disorders, and who are not stabilized with ongoing voluntary treatment or unlikely to survive safely in the community without supervision. So this is a very narrow population of folks that are eligible to be enrolled in this program. Now, the idea behind the program is that there's a concern that there are individuals who are unaware that they need behavioral health services. And so this is supposed to give a mechanism for other people in their lives to help identify this individual needs behavioral health this individual needs behavioral health help, and for those other people in their lives to be able to file what's called a petition with the court in order to initiate services for that individual. So there's a very specific list of individuals who can file a petition, but long story short, it's basically family members, service providers, and first responders that are able to file a petition on behalf of the individual. Then goes to the court, and the court process proceeds. We'll offer voluntary services right away, immediately, and if the individual is willing to participate in our services voluntarily, then we're good to go. If there needs to be more of a court process, then we'll engage with the courts, with the judge, and have those types of conversations. One of the things we do want to clear up is that there is misunderstanding or a misunderstanding within the community that the court can compel treatment, can force somebody into treatment, and that's not the case. Likewise, the courts cannot compel the individual to take medications, but they do serve a very important function in helping connect and reinforce the importance of services in those individuals' lives. Now, this Care Court process, we go live December 1st of this year, so we're very excited. We are staffing up, ramping up, and we're ready to go. So look out, and if you have any other questions, we do have a webpage. If you searched Behavioral Health Services Sacramento County Care Court, you'd be able to find that information.
I did that, and the right website came right up. So that's a good way to search for that. So Prop 1, tell us a little bit about Prop 1. What is it, and how does that affect you?
Prop 1, okay. So this was a voter initiative that was on the ballot almost a year ago now. And that voter initiative made some changes to how our funding is being prioritized for funding activities and services within the community. Prop 1 did not provide any additional funding to counties in order to implement new programming. What it did is it took our existing funding and it carved out 30% that would be prioritized specifically for housing. So as you can imagine, whenever you're managing your home budget, if you need to spend more money in one area, that means money has to come from another area in order to fund that. So we're going to have to be doing some big decisions and planning. Now the law does require us to have a community planning process, and that's part of our core values anyway. We would do that even without it being in the law. We really value the importance of getting feedback from community in terms of how we want to implement our programming. Now, the law doesn't go into effect until July 1st, 2026, which is just under 2 years from now. So we have a little bit of time. And meanwhile, the law was actually written pretty quick and had a number of unanswered questions. And the law actually recognizes that and gives the Department of Health Care Services at the state a responsibility for providing secondary guidance. And so right now we're in the process of waiting for that secondary guidance. That should be coming hopefully early 2025, and then we'll begin the planning process so we can be ready to go July 1st, 2026.
Wow, so you've got some work ahead of you.
Absolutely.
But involving the community, that's always a wonderful thing.
Yeah.
So, Dr. Quist, you provided us with a lot of information and resources today, and thank you so much for that. Just finally, if there's one thing you'd like our listeners to take away from this episode, what would it be?
There is always help out there. Make sure that as we go through these holidays, that you're paying attention to how you're feeling. And if you need help, please talk to somebody. It doesn't have to be formal help. It can be just having a conversation around how you're feeling and how you're coping with that. Let's normalize talking about how we're feeling. Let's normalize that it's okay to feel stressful during the holidays. And if you need help, please reach out for help. If it gets to the point where that's not going to work and you need professional help, please do reach out. I'm going to give you some resources that you can access in order to find help. First of all, if you have private insurance, please be sure to reach out to your insurance provider and get a referral in order to get into services. If you have Medi-Cal, then you can certainly reach out to the county and we can make sure that you get to the right place to receive services. We also have what we call our mental health urgent care clinic, which is open 24 hours a day, 7 days a week on Stockton Boulevard. If you Googled that, you would be able to find the address and be able to find how to locate that. If you're experiencing a crisis at any time, please, we have a new national resource, just dial 988, and you'll be able to get in touch with somebody who can help you with that crisis. And finally, if you're not in a crisis but want an opportunity to have a conversation with somebody and just talk about how you're feeling, you can try out what's called Cal Hope. It's all one word, C-A-L, Hope. You can, again, Google that online and you'll be able to find their webpage, or I can provide you their phone number. But again, if you Googled it, you'd be able to find that phone number. The number is 833-871-HOPE.
Dr. Quist, thanks again for coming in and sharing your knowledge and your perspective with our listeners. The county is really lucky to have a caring person like you in the position you're in. So thank you again.
Thank you so much.
To our audience, thanks so much for joining us. We hope you enjoyed this podcast, and we hope you'll listen again as we feature different county department leaders throughout our series, County Conversations.